Trauma-Informed Teaching Practices by Jessica Beccarini for Dr. Frank Mora, SEL 605, Culture and Identity, July 2021. Trauma-informed teaching is thinking you're taking a straightforward route and finding out you have to detour. Actually, it is a whole lot of randomness because there is not currently a systematic framework used by schools. Maynard et al. 2019 says there is a lack of evidence of trauma-informed approaches in schools. Although teachers hope to buffer stress with trauma-informed teaching, at this time it is a lot of higgledy-piggledy. According to Forbes 2013, ACEs, or Adverse Childhood Experiences, cause uneven development of foundational skills like self-regulation and executive functioning. When the amygdala is activated, students cannot learn. According to Shin 2021, unresolved trauma interrupts social-emotional learning, especially self-awareness. Trauma-informed teaching is supportive of the youth who have experienced trauma. According to Maynard et al. 2019, trauma impacts between 4% and 71% of the student population. That means you need to know your particular students and prepare supportive measures that are appropriate for the needs of your students. Some students will need less supports, such as a harness and carabiner, but some will need the whole staircase and have to go step by step. Trauma-informed teaching should be utilized whenever students indicate need. Although many teachers have found the magical healing properties of a wet paper towel or a placebo bandage, these imaginary and temporary fixes are inappropriate when dealing with trauma. Trauma-informed practices. First, recognize trauma. 2016, Goodman et al. Second, understand trauma. 2014, DeCandia et al. Third, counter trauma. 2019, Maynard et al. Fourth, offer choice and control. 2016, Goodman et al. Recognizing trauma means paying attention to the students and getting to know their backgrounds. Trauma can manifest in many ways. This practice is most equitable when we understand how abuse and other difficulties affect responses in the body. Understanding trauma helps us become more proactive instead of reactive. We can determine when a student is thinking logically with their neocortex and when a student has flipped their lid and is using their downstairs brain. This practice is most equitable when we treat our students with dignity. When we counter trauma, we help students become resistant to being re-traumatized. We counter trauma by being supportive when a student is feeling stressed out or overwhelmed. When they are in a regulated state, we can teach explicit coping strategies. This practice is most equitable when it is embedded with collaboration and mutuality. Sharing power and governance empowers both teacher and student. It increases a feeling of autonomy, which can strengthen a student to resist future traumas. Before implementing trauma-informed teaching, first, have separate spaces for enforcing consequences versus regulating in a safe space. According to Help for Billy, this is an important distinction that our students need. Second, examine instructional materials in all domains for potential trauma triggers. For example, one of my word sorts had an image of a water gun squirting water. This was alarming to my students who have witnessed gun violence, and one even mistook the water droplets for blood. Finally, you can begin implementing trauma-informed practices. Refer to Trauma-Informed Care and Trauma-Specific Services, a Comprehensive Approach to Trauma Intervention by DeCandia et al. Getting Started with Trauma-Informed Practices, Edutopia. Help for Billy, a Beyond Consequences Approach to Helping Children in the Classroom by Forbes. Photos and Images from Dreams Time. Development and Validation of the Trauma-Informed Practice Scales by Goodman et al. Effects of Trauma-Informed Approaches in Schools, a Systematic Review by Maynard et al. Why the Nation Should Screen All Students for Trauma like California Does by Shin. Trauma Stock Photos and Images from 123rf.com. And Calming Music from Yellow Brick Cinema.